What is the MCL6 lead? Variation of the V6 lead and views the low lateral wall of left ventricle, and the negative electrode is placed below the left clavicle toward left shoulder, and the positive electrode is placed in the fifth intercostal space, left mid-axillary line, which leads view the inferior heart surface. Two, 3, and VF, which leads view the septal heart surface. V1 and V2, which leads view the anterior heart surface. V3 and V4, which leads view the lateral heart surface. 1. A VL, V5 and V6. Can pancreatitis be secondary to ulcerative colitis? False. What kind of hormone is found elevated in obesity? Leptin. When do you expect to find signs and symptoms of superior and inferior mesenteric insufficiency? Postprandial or post-cybos? Appendicitis is related to volvulus? False. What are you predisposed to if you have diverticulosis? Diverticulitis. What are you predisposed to if you have diverticulitis? Perforation, sepsis, and peritonitis. What is the etiology of ulcerative colitis? Autoimmune. What is one of the complications of Crohn's disease? Scarring and malabsorption. Complications of low secretion of lipases? Fatty stools, night blindness and hypocalcemia. What is the bottom line of the development of ulcers? Excessive secretion of pepsin and hydrochloric acid, high hydrogen ion levels. What is the name of the most notorious post-pilorectomy syndrome? Dumping syndrome. Helicobacter pylori infection leads to alkaline gastritis? False, acidic gastritis. What kind of obstruction is paralytic ileus? Functional obstruction. What is the main situation in which you find succussion splash? Pyloric stenosis/obstruction. What is actually happening in fighting hiatal hernia with regards to the stomach? Stomach interception. If you denervate the smooth muscle of the esophagus, what is the result? Achalasia. One important cause of occult bleeding of the GI tract leading to severe anemia? Necator americanus. types of diarrhea? Osmotic, secretory, and motility. What is the name of the inflammation of the gallbladder? Cholecystitis. What is the name of the presence of gallstones? Cholelithiasis. What is the name of the fibrotic reduction of hepatic function? Liver cirrhosis. Is cirrhosis reversible? False, it is not. Name some kinds of icterus. Hemolytic and obstructive. What produces esophageal varicosis? Portal hypertension. Duodenal or esophageal or gastric ulcers are what kind of ulcers? Peptic. The hernia occurring between the pelvic cavity and the inguinal canals are called hiatal? False, they are called inguinal. Painful swallowing is also called what? Adenophagia. What are the similarities between hematmesis, melena, and hematochezia? They are all bleeding from the GI tract. What kind of pains could you have in your abdomen? Parietal, visceral, and referred. What is the characteristic of projected vomiting? Not preceded by retching. Define anorexia. Lack of a desire to eat despite physiologic stimuli that would produce hunger. Define vomiting. Forceful emptying of stomach and intestinal contents through mouth. Define nausea. Subjective experience that is associated with multiple conditions. What are some common symptoms of vomiting? Hypersalivation, tachycardia. Define retching. Non-productive vomiting. Define constipation. Infrequent or difficult defecation. What are some risk factors producing constipation? Neurogenic disorders, functional or mechanical conditions, low residue diet, sedentary lifestyle, excessive use of antacids, changes in bowel habits. Define diarrhea. Increased frequency of bowel movements, increased volume, fluidity, weight of feces. What parts of the digestive system are associated with upper GI bleeding? Esophagus, stomach, duodenum. What parts of the digestive system are associated with lower GI bleeding? Bolotroit's ligament or jejunum, ileum, colon. Rectum. Define dysphagia. Difficulty swallowing. Define achalasia. Denervation of smooth muscle in the esophagus with lower functional narrowing of esophageal sphincter. Define gastroesophageal reflux. The reflux of chyme from the stomach to the esophagus causes inflammation of the esophagus. What are some manifestations of gastroesophageal reflux? Heartburn, regurgitation of chyme, upper abdominal pain within 1 hour of eating. What are the types of hiatal hernia? Sliding hiatal hernia, paraesophageal hiatal hernia. Define a pyloric obstruction. Blocking or narrowing of the opening between stomach and duodenum. What are some manifestations of pyloric obstruction? Epigastric pain and fullness, nausea, secussion splash, vomiting, prolonged can cause, malnutrition, dehydration, extreme debilitation. Define intestinal obstruction. Obstruction that prevents the flow of chyme through intestinal lumen or failure of normal intestinal motility. What is an ileus? Obstruction of intestines. What are the types of intestinal obstruction and ileus? Simple, functional. Define gastritis. Inflammatory disorder of the gastric mucosa. Types of gastritis. Acute, chronic. Define peptic ulcer disease. Break or ulceration in the protective mucosal lining of lower esophagus, stomach or duodenum. Types of peptic ulcer disease. Acute and chronic, superficial, deep. What are the main causes of peptic ulcer disease? Non-steroidal anti-inflammatories Helicobacter pylori increased acids, pepsin, decreased bicarbonate. Generally, where are gastric ulcers? Tends to develop in antral region of stomach, adjacent to acid-secreting mucosa of the body. What is the primary defect gastric ulcers? Increased mucosal permeability to hydrogen ions. What are the developmental factors for duodenal ulcers? Helicobacter pylori infection, hypersecretion of stomach acid and pepsin, high gastrin levels. Define stress ulcers. A peptic ulcer that is related to severe illness, neural injury or systemic trauma, ischemic, Cushing. What are some post-gastrectomy syndromes? Dumping syndrome, alkaline reflux gastritis, afferent loop obstruction, diarrhea, weight loss, anemia. Define dumping syndrome. The rapid emptying of chyme from a surgically created residual stomach into the intestine, clinical complication of partial gastrectomy or pyloroplasty surgery. What are some developmental factors for dumping syndrome? Loss of gastric capacity, loss of emptying control, loss of feedback control by duodenum when it's removed. What are some cancers of the gastrointestinal tract? Esophagus, stomach, colon and rectum, liver, gallbladder, pancreas. Define gallstones. Cholesterol stones form in bile that is supersaturated with cholesterol. What is the most common problem associated with gallstones? Obstruction or inflammation. Define maldigestion. Failure of the chemical processes of digestion. Define malabsorption. Failure of the intestinal mucosa to absorb digested nutrients. Maldigestion usually occurs with what other syndrome? Malabsorption. What are some causes of pancreatic insufficiency? Pancreatitis, pancreatic carcinoma, pancreatic resection, cystic fibrosis. What enzymes are insufficiently produced in pancreatic insufficiency? Lipase, amylase, trypsin, chymotrypsin. What happens when there is a lactase deficiency? Inability to break down lactose into monosaccharides, therefore prevent lactose digestion and monosaccharide absorption. What does the fermentation of lactose by bacteria cause? Gas, osmotic diarrhea. What are conjugated bile salts needed for? Emulsify and absorb fats. What is synthesized together to form conjugated bile salts? Cholesterol in the liver. What is caused by deficiency in vitamin A? Night blindness. What is caused by deficiency in vitamin D? Decreased calcium absorption, bone pain, osteoporosis, fractures. What is caused by deficiency in vitamin K? Prolonged prothrombin time, purpura, petechial. What is caused by deficiency in vitamin E? Uncertain. Define ulcerative colitis. Chronic inflammatory disease that causes ulceration of the colonic mucosa, usually in sigmoid colon and rectum. What is the treatment for ulcerative colitis? Antibiotics and steroids, immunosuppressive agents, surgery. What happens in Crohn's disease? Ulcerations can produce longitudinal and transverse inflammatory fissures that extend to lymphatics, causes skip lesions, found throughout the GI tract. Anemia can happen due to malabsorption of B12. Define diverticula. Herniations of mucosa through the muscle layers of colon wall, especially sigmoid colon diverticulosis, asymptomatic diverticulitis, inflammatory stage of diverticulosis. Define appendicitis. Inflammation of vermiform appendix, produces rebound tenderness, causes obstruction, ischemia, infection, ulceration. What % of Bos mass index classifies obesity? Greater than 30%. Describe anorexia nervosa. A person has poor body image disorder and refuses to eat. Define bulimia nervosa. Body weight remains near normal but with self-induced vomiting to lose weight. Define starvation. Decreased caloric intake leading to weight loss. Define portal hypertension. Abnormally high blood pressure in the portal venous system caused by resistance to portal blood flow. Most common clinical manifestation equally esophageal bleeding, pre, intra and post-hepatic. Define hepatic encephalopathy. Increased ammonium levels. Cells of the nervous system are vulnerable to neurotoxins absorbed from the GI tract, because of liver dysfunction circulate to the brain. Define cirrhosis. Irreversible inflammatory disease that disrupts liver function and structure. Biliary channels become obstructed and cause portal hypertension. What are the etiologies of primary and secondary biliary cirrhosis? Primary equal autoimmune, secondary equal obstruction. Where can you find hepatitis A? Can be found in feces, bile, and serum of infected individuals, usually transmitted by fecal oral route, viral infection. How is hepatitis B transmitted? Through contact with infected blood, body fluids and contaminated needles. Maternal transmission is mother is infected in third trimester. Hepatitis C is responsible for most cases of what hepatitis? Post-transfusion hepatitis, 50% to 80% of chronic hepatitis. What are the different phases of hepatitis? Incubation, prodromal, icteric, recovery. What is the relationship between hepatitis B and D? Hepatitis D depends on hepatitis B for replication. How is hepatitis C transmitted? fecal-oral transmission, usually in developing countries. How is hepatitis G transmitted? Parentally, sexually transmitted. What is hematemesis? Vomiting blood. What is hematochezia? Blood in the stool. What is melena? Discolored stool. What is occult bleeding? Bleeding we can see, usually found in chemical testing. What is the antidote for cholinergic poisoning? Atropine. What is the name of praloxidine? 2 p.m. What do you use pralidoxime for? Cholinergic poisoning. What kind of drug is 2 p.m.? An acetylcholinesterase activator. What is the antidote for paracetamol poisoning? An acetylcysteine. Is Inaceum mucolytic or mucus fluidificant? Yes, acts by decreasing the thickness of mucus. What is the antidote for opioid withdrawal? Buprenorphine. The antidote for opioid poisoning is what? Naloxone. Fluoxetine is the antidote for benzodiazepine poisoning? False, it's flumazenil. What is the name of the calcifying lesion at one spider bite site? These is no such name because spider bites do not cause calcification. What do spider bites produce? Necrotizing arachnoiditis. What is the most visible sign of copper poisoning? Caterfly shearings in Wilson disease. Metals that produce poisoning include heavy metals such as lead, mercury, copper, iron, and arsenic. What is the bottom line of treatment with lithium poisoning? Copious amounts of fluids. What is the most important molecule in the treatment of cyanide poisoning? Nitrites. Know the signs and symptoms of organophosphate poisoning? Tremor, sialorrhea, meiosis, and diaphoresis. LSD is a narcotic? False, it is a hallucinogen. What is the active ingredient in marijuana? Cannabinoids, delta-9 THC. Most common addictive amphetamine is Ritalin. What kind of drug is cocaine? An alkaloid stimulant. All alkaloids are stimulants. What is the difference between potentiation and synergism? Synergism is a coordinated action of two or more drugs to create a greater effect. Potentiation is the potential effect a drug has when another is added. What is the similarity between envenomation by spider bite and snake bite? They are both injected. What is the kind envenomation produced by spitting cobra? Absorption via mucosa or sclera. The antidote against albuterol is beta blockers. If epinephrine increases positive inotropic response, it increases the force of contraction of the heart? True. What is the treatment for anaphylaxis toxin released by hydatid cyst? Epinephrine. Diltiazem is a beta blocker? False, it's a calcium channel blocker. Zolocortif is a natural corticosteroid? False, it is a synthetic. The antidote for beta blocker poisoning is what? Glucagon, because it is inotropic. Is glucagon also a smooth muscle relaxant and a prokinetic? True, its anti-hypoglycemic effect causes increase in plasma glucose levels and smooth muscle relaxation. What is synonym of stroke volume? Afterload. What state of mind will you find in a person with sympathomimetic overdose? Excitation. What is the name of excitability of the heart? Dromotropism. What is the difference in the action of sublingual nitroglycerin and IV nitroglycerin? Nothing. Kids cannot receive glucagon? False, they can based on their weight. What is the reaction of the load of the heart with the use of nitroglycerin? Preload decreases. What are the similarities on pharmacology of NGT and morphine? They both are vasodilators. What is the poisoning that leads to the green tongue syndrome?